All right, Dr. Brusovanik, let's get started. We have a video question from Paola. Let's see what she has to say.
Hello, Dr. Brusovanik. How you doing? I hope so you're doing pretty well. I have a couple of questions that it is normal that after, even though we did the surgery, I still can have some cervical pains. That is this normal or or is part of the process of the healing? If you can answer me that, I really appreciate it to see what I can do better to improve the pain that I'm having in my neck.
Doctor, what are your thoughts with Paola's question?
Well, it's a tough question, especially in patients who have already had spine surgery where I'm trying to correct the old problems. It's important to be very specific on which elements of her neck are causing which pain. Remember, so some patients will say, I have pain when I do my hair. I have pain deep to the shoulder blade. I have shoulder pain when I sleep. I have a headache, pain behind the jaw, and pain going down the arm. Each one of those elements deserves its own attention. And oftentimes, in order to know whether this is a normal part of healing or whether this is really a static problem that deserves its own attention, oftentimes we'll use various injections. And obviously, if you inject an area with a local anesthetic and the pain goes away, then you can assume that that's indeed the cause of that pain. So it just behooves the patients, really makes it very important for patients, if they're suffering with whichever kind of aches and pains, to make an effort to obtain a proper diagnosis, figure out why you are suffering.
You hear this question often, and here it is. I already had spine surgery. Why am I still in pain? And I've heard that before from other people that I know. They have surgery and they're still in pain. Why is that, doctor?
That's a great question. A lot of patients suffer with this. With classic spine surgery, about 36% of patients would go back and say they still have pain and they need to have more work done. So most patients who have spine surgery and are still suffering fall into two categories. Either it's going to be a problem with what was done surgically, frequently a non-union or what's called a pseudoarthrosis. The other possibility is a degenerative disc either above or below the fused site. So by obtaining an MRI and the CAT scan, we could objectively evaluate the discs above and below and see what's happening within the surgical site, under the screws, around the screws. Most patients will fall between those two categories, and both of those situations can be corrected with the newer minimally invasive techniques. So don't despair. If you've had surgery and you're still suffering, then it's reasonable to make an effort, obtain a diagnosis, and then expect a good outcome.
And doctor, I want to follow up on that question because I don't usually share personal stories, but my stepfather, who is a patient of yours, he's going to be undergoing surgery with you in the next few weeks. And I want to talk about these minimally invasive techniques that you are doing now. My stepfather obviously thinks of surgery way back when and doesn't really understand these techniques that sometimes, and you and I have talked about this, patients go in, you do the surgery, it's minimally invasive, and within 24 hours, they're up and walking and back home. It's amazing.
It's true. The innovations, though, are very intuitive. The smaller the incision, the less pain, less muscle injury, less rehab. Less smaller incisions also means less blood loss. Better magnification and better lighting means that the surgeon is empowered to do more within depths of the human body and better tools. So I think you'll see most younger surgeons coming out of training performing these advanced operations through minimally invasive techniques. The results are different, objectively different. So it would be strange to see the old, big, classic open techniques where there are younger surgeons who are doing it in a minimally invasive fashion.
And doctor, you've had patients where after 45 minutes in surgery with you, within a few hours are sitting up again and walking. I've seen it.
So that's what I'm expecting for your dad, because stenosis is such a common problem and it's such an easy operation. If you don't hurt the patient, if you sneak in, correct the problem, and sneak out, you can expect a patient to wake up, say that they have no pain, get up and say that their legs no longer hurt. If they had stenosis that was forcing them into flexion and making them unable to stand up straight, as soon as they wake up from the decompression, they're able to stand up straight. It takes a few weeks to get through the postoperative pain, and we take pain medicine for this. So it's still spine surgery and it's taken with full respect, but the less you hurt the patient, the less the patient will hurt.
Absolutely. Okay, doctor, we have another video question. This one is from Lee. Let's take a look.
I had a total disc replacement of C5, C6, and I was wondering how long that device will last. Is there going to be a lifelong pain relief surgery?
Doctor, what are your thoughts on that question?
It's a great question. There's some real interesting articles about this topic that address this question. When you talk to the world experts, they'll tell you that they are not revision experts because these discs just aren't falling apart. The parts are the same as what's used in a total hip. So we have a real good track record up to 40 years with some of these total hip configurations. But the failure rate that we see in the hip and the failure modes, we are not seeing with the cervical spine. Most total disc replacements fail because patients develop arthritis and the discs stop moving. But since there is no way to lose the height, the movement stops and the neck continues to maintain proper posture. Long-term studies are showing that you also minimize the risk of having a problem above or below when it's a disc replacement, as opposed to a disc fusion. So to Lee, I have nothing but an optimistic outlook for the long-term survival of your disc replacement.
Just a reminder to our viewers, if you have a question, please send them in. It's very easy. Just email us to questions@allhealthtv.com. Give us a call, 855-796-4475, or just check out our website, allhealthtv.com.
Doctor, can you highlight also what non-surgical procedures work to help back pain?
Non-surgical, from top down, epidural steroid injections, facet joint injections, those are probably most effective. A proper abdominal strengthening program, stretching, that works as well. And then some modalities work for acute short-term pain to relieve that spasm. And that includes physical therapy, chiropractic care, acupuncture, amongst others. But if that pain keeps coming back, then it's usually the more advanced techniques that will address the underlying cause.
How did these injections work, doctor? And for some people, is it just a Band-Aid that just kind of buys some time?
It is a Band-Aid for those who have primarily a compressive problem. If inflammation isn't the dominant cause of their pain, then the steroids will provide either short-term or incomplete relief. It's not truly a Band-Aid because it does provide your surgeon a way to sneak a peek into the future, a way to know whether addressing that very disc with a surgical operation will result in a predictable outcome. You want that before you go to battle. You want that before you take the risks and the possibilities of different complications. You want to know that in the end, it will be all worth it.